So I was still a basic beginning EMT, and I was working in Southern California. Our radio started giving us information to respond to the border of California and Mexico. The city on the Mexico side is Tijuana, and the city on the United States side is Otay Mesa. That's part of California. So we got a call to respond to the border, which is interesting because we don't go into Mexico, but we're responding to the border. And apparently there was a motor vehicle accident. And what happened, we found out, was there was a motor vehicle accident on the Mexico side. And at this particular part of the border, there was a cliff about 20 feet from the California side was down below. The Mexico side was 20 feet above. And there was a residential or a street at the top of the cliff on the Mexico side. And there was, I guess, a motor vehicle collision at the top on the Mexico side. And apparently, not only motor vehicles collided, but they also hit some pedestrians that were walking. So when this happened, people got knocked off of the cliff and fell 20 feet down into the USA side. And there were also some vehicles that came off the cliff and landed on the California side. And it was called a MCI, or a multi-casualty incident, where there was multiple people. So all ambulances responded, and they tried to coordinate some system to line up all the ambulances and release them one by one to go get the patients and then turn around and go to a hospital in the United States. We went to a staging area. It's an area where they coordinate all the ambulances, and then they organize them to go and get patients. So a paramedic came up to our window and said, "Go to those two patients and take them to this hospital." We said, "Okay, cool." So we responded down to these people, and there was people everywhere. I mean, there were paramedics, and sometimes you don't know who the people were. They were walking around. There were people hurt. There were people yelling, people crying, people walking. It was chaos, organized chaos. So we went in, and we had two people already on the ground, and we were putting them on what we call a backboard that helps stabilize their spine in case they have any injuries. And then we strapped them down to a board, and then we put them in the ambulance, one on the gurney or the bed, and then one up on the bench seat. It's a long bench seat, so we can put two people side by side. And I'm in the back, and my partner's driving, and we go to the hospital that we were directed to. Well, while we were finishing packaging these two patients on the ground, I look up, and there's a 20-year-old Hispanic kid. I remember he had a red bandana around his neck. And he's walking back and forth, and sometimes he would stop and try to assist us, or he would try to help somebody else. And I saw him walking back and forth while I was doing my job. And I just remember seeing that kid and his red bandana. And as we're finishing packaging these patients and putting them in the back of the ambulance, I heard something aloud, somebody say something loud, and I turned and I looked, and that kid with the red bandana is now flat on his back in the dirt, and there's somebody on top of him doing chest compressions. And I thought, what the? Is that the same kid and I looked, it was the same 20-year-old kid with the red bandana, now unconscious on the ground, and somebody's doing chest compressions on him. And I thought, what? He was just walking moments ago, and now he's dead on his back, and there's somebody compressing his chest. And I thought, it just didn't make sense. But I thought, whoa. So we finished putting the patients in the back of our ambulance while they continued doing chest compressions on this guy. And we left, and we went to the hospital we were directed to go to. And when we got there, apparently there was bad communication. They didn't even know we were coming. And eventually they accepted our patients, and we left. I don't remember if we went back to the scene or what, but I just remember that call. It was so many years ago, the very beginning of my emergency medical career. And I witnessed, but what more than likely happened was that kid was also a patient who was knocked off of that cliff and fell 20 feet into the United States side. And he thought he was okay, and he was trying to help other people. And then whatever happened inside of his body ruptured or something, and he ended up collapsing on the ground. He didn't do very well, I'm sure. Anybody that ends up having chest compressions on them or CPR, as most people know it, they don't do very well. If you end up losing your heartbeat or stop breathing from trauma, it takes a lot of trauma to kill somebody. It really does. People don't realize that. Hollywood depicts another picture, but it's not true. To kill somebody from trauma, you either need to put a bullet in their head or a bullet through their heart. That'll kill somebody. But otherwise, you can put a bullet through their shoulder and their stomach and their groin and their leg and their arm, and that doesn't necessarily kill somebody. That just requires surgery. I mean, it can kill you, but somebody dying from trauma is the exception, not the rule. No matter what the TV tells you or the movies tell you. So anyways, yeah, that was one story that I don't think I ever told before.